and good morning. Welcome to our live stream from Deuk Spine Institute, Thursday, May 14, 2026. Our patient is from Florida, and he actually was scheduled for a fusion on his neck. 3 levels, 3 discs, c4-c5, c5-c6, c6-c7. Then his wife, who has been taking care of fusion patients for years, became very concerned about complications and bad results of spinal fusion. So she started digging around, doing research, and discovered the Deuk Spine Institute. She did her research, learned about the laser procedure, and here he is today having the Deuk laser disc repair procedure done, which is truly the most advanced form of spine surgery for degenerative problems like herniated disc, bulging disc. This is a form of laser spine surgery, but it's unique, and it was pioneered here at Deuk Spine Institute by me 20 years ago. We've been doing this surgery now for 20 years. And in 20 years, I've performed 2,768?
Yes, that's correct.
2,768 procedures, endoscopic laser, on the neck, the thoracic, and the lower back. He will be 2,769. All right, we're going to get started. If you have questions, feel free to type them, and Anthony will ask me the questions live during surgery. I'll answer them for you. In the meantime, Anthony, let's show the audience the 30 different causes of chronic neck pain that exist today.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain.
Welcome back, Sean. Our patient is here with neck pain coming from the herniated disc. Sean, I'm in the middle of placing the needles, AP. Don't move. Once the needles have been placed properly, then we can proceed with the laser surgery that we're going to be doing today. So far, so good. Everything is going perfect for him. That's perfect right there. All right. So, Sean? Great. Now, what I'm going to do today is we're going to fix 3 discs. Jordan, let's count for the audience. And Anthony, you're on the x-ray, right?
Yes, I am.
All right. So look at the white arrow. C2, 3, 4, 5, 6, 7. We're fixing 4, 5, 5, 6, 6, 7. Those 3 discs. I'm going to start by fixing 5, 6. I'm going to do a discogram shot. All right, look at the tear. So we got dye coming out of the disc from a tear in the back. You guys see the tear there?
Yes, we
That
do.
tear should not be there. That tear is abnormal. And that tear is what allowed the herniation to occur that I'm going to go clean up right now. I'm going to do the same thing at 4, 5. I'm going to do a discogram. Shot. Shot. And there's another tear. Shot. Okay. Now, Jordan, show the audience the tear at 4, 5. Look at that tear in the annulus. That's called a posterior annular tear. That occurred through trauma, some type of trauma to his neck. He tore that ligament that connects the top bone to the bottom bone. It's circumferential, ring shape, called the annulus fibrosus. Show them the herniation in the back there. There's the herniation. Show them the herniation at 5, 6. There's the herniation. At this point, I'm going to start my surgery. I've accessed 5, 6, and 4, 5. I want you guys to look here. Go to the eye in the sky. Can you guys see this?
Yes, we can.
We're on the left side because he's got symptoms in both arms. He's got radiculopathy, pinched nerves, which are causing atrophy or weakening of his muscles. I'm going to start with the 5, 6. We're making a 4 millimeter incision. 4 millimeters, folks. This is tiny. The entire surgery will be done through a 4 millimeter incision. I'm going to try to do all 3 discs with one 4 millimeter incision, but I'm not going to compromise safety. So if I'm unable to do both, all 3 discs with one incision, I'm going to make a second incision and do 4, 5 with a second incision. But I'm going to try first to do all 3 with one incision. There's no bleeding. There's no hospitalization. This is outpatient surgery. You are watching the most advanced spine surgery in the world for treating a herniated disc. Our patient is completely asleep. He has a tube down his throat, and he is under anesthesia. Shot. All right, you can see after I made the 4 millimeter incision, I used what's called a dilator, which is a skinny little metal pencil-like object, to spread apart the tissues underneath the skin. And the dilator does not cut, it spreads. Just like putting a pin through your shirt. Whoa, look at that, look at that. That's amazing. You guys see the AP view, X-ray?
Yes, we do.
All right, Jordan, show the audience the tip of the dilator sitting in front of the disc. There it is, right in the midline. Show them the tear in the back of the disc on both sides. Look at that. Number 5, 6 has a tear on both sides, and you can see the dye has escaped through the tears on both sides, and it's getting on the nerve root. That's the nerve root right there that we're pointing to. That's the right C6 nerve root. There's the left C6 nerve root. So, clearly, he has damage to this disc. He's got a herniation. He's got pain. He's got radiculopathy. And we're going to be treating that right now. I'm starting by advancing my dilator through the disc to the back where the herniation is. We're going to keep an eye on the needle at 4, 5 to make sure it doesn't move. We're going to keep an eye on the dilator at 5, 6 to make sure we don't go in too far. If you have questions, feel free to type them up. Anthony will ask me. Now, I want to show the audience this tube. This surgery is going to be done through this 4 millimeter tube. Take a look at this thing. 4 millimeters. The whole surgery. No more ACDFs. No more artificial discs. No more spinal fusion. This guy was scheduled for a spinal fusion. He literally, one day before, came to our clinic and consulted with me. I stopped his fusion, and here he is getting his herniated disc fixed the right way, the way that every patient in the world will have them fixed in the future. This is called transdiscal anterior cervical endoscopic Deuk laser disc repair, pioneered by me, the founder of Deuk Spine Institute 20 years ago. I learned the basic endoscopic technique from the South Koreans. Dr. Sang-ho Lee taught me the transdiscal endoscopic approach. And of course, I developed the laser annular debridement, which is the most important part of the surgery. That was added by myself. Dr. Berndes gets a big round of applause today for getting this innovation done. It was not an easy one. Some patients are more difficult than others. He was a level 10, a new level 10, right? Like he redefines level 10. Hold on, let me just see if I can get it. But we do have, as he said, the best equipment here. We had to use the glide scope, right? All right, I'm going to bring my dilator back just a millimeter. It's getting a little bit ahead of itself, and I still need it, but you cannot advance the tube without the dilator. That's perfect. I'm going to go 1 more millimeter. Now, a millimeter doesn't seem like a lot, but it is a lot when you're dealing with the spine. Okay? I think that's about it. Let's see where that is. Shot? That looks pretty good. I'm happy with that. So, folks, take a look at this. Bloodless surgery. We're going through the front of the neck. This is laser spine surgery. It's done endoscopically. You cannot do laser spine surgery properly without an endoscope. So it must be done with the endoscope. So this is endoscopic laser spine surgery. Watch that. Any questions?
Yes, we have a question from Lanu on YouTube.
Sure. Suction on.
Can aging cause herniated disc?
Aging does not cause herniated disc. Trauma causes herniated disc. There are many people out there, 80 years old, that have no herniated disc or degenerated disc. Okay? We think we say aging causes herniated disc, but it does not. Herniated discs are caused through trauma, and they don't become symptomatic until years later. All right, we're going to go to the endoscopic view. Go ahead and toggle us to the endoscope. Can you see the endoscopic view?
Yes, we can.
All right, what you're seeing is you're looking down a 4 millimeter wide tube, and the inside diameter is 2.8 millimeters, and you're seeing the laser fiber at 12 o'clock. I'm turning it on with a foot pedal. That's a piece of herniation right there. You guys are seeing the first piece of herniation coming out. I'm removing it by floating it right out of the tube. There's another piece of herniation. This is c5-c6. We're starting with c5-c6. We're going to go to c6-c7 next. Another piece of herniation floated out. And I'm going to just do this over and over until I get all the herniations and bone spurs I need to remove. If you have questions, feel free to ask. But I think at this point, we've talked about the 30 causes of neck pain that we discovered here at Deuk Spine Institute, and we're sharing with you, the world, those 30 causes. You won't find them anywhere else, because other doctors really don't know what causes neck pain. They haven't figured it out yet. Why don't we show the audience how a herniated disc, which is the most common cause of neck pain, causes neck pain.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Animation video, you can see how the #1 cause of neck pain in the world causes neck pain. It's called a herniated disc. Now, just to clear up any confusion you folks may have, okay, what is a herniated disc? You get a tear in the annulus traumatically. It also fractures and fragments the nearby nucleus pulposus, which is basically a gel in the middle of your disc. Look at the size of that herniation right there. It's humongous. And then the pieces of herniation just make their way out through the tear, okay? And you get a herniation that way. That is also called a bulging disc, a protruding disc, a ruptured disc. So herniated discs have many names: slip disc, bulging disc, ruptured disc, protruded disc, bulging disc, but they're all herniations. And over time, due to inflammation happening over years, that disc will lose its height, it'll turn dark, and it will become a degenerated disc. Tape measure. Let me show you a piece of herniation I just took out. Can you all see this, Anthony?
Yes, we can.
This thing is about 5 millimeters, okay? But I'm going to take out about 20 of these. That's what a herniation really is. It's about 20 pieces, okay? Maybe 30 in some cases, 40 in others. Everybody's different, but I'd say the average is about 20 pieces in the neck for a cervical disc herniation, and maybe in the lower back, 40 pieces. You can see the annular tear. I'm going to get to the questions in a moment, but I do want you all to understand that the number one cause of neck pain in the world is a herniated disc. It accounts for about 85% of all chronic neck pain. And most people don't have one herniated disc, they have 2.5. That's the average, is 2.5. So you can't have a half a herniated disc. What you can have is 2 or 3. And the average is 2.5. You understand? So very few people have one herniated disc causing symptoms. Most people have 2.5 herniated discs causing symptoms. All right, we'll take our question.
Yes, we have a question from Lanu on YouTube. Why is c5-c6 a very common location for herniated disc?
Great question, Lanu. So Lanu from Singapore, I believe, right? Or Indonesia, I can't remember. Do we remember where Lanu comes from? Maybe she can tell us. I don't think she told us last time. There's another piece of herniation. Why is c5-6 the most common disc herniation? Lanu is correct. c5-c6 is the most common disc to herniate and cause symptoms. c6-7 is the second most common, and c4-5 is the third most common. Why? The answer has to do with the structure of your spine, the way it's designed and built, and the way forces are applied to the spine, external forces, like when you have a football injury or a car accident. So the way that those forces are applied to your spine determine where the maximum amount of rotation and what's called shear forces are applied, and they're maximally applied at c5-6, c6-7. But also the discs there are more vulnerable to injury because of what's called the plumb line, which is where the center mass of your skull passes through c5-6, c6-7. It's at such a location that when you have trauma, that plumb line forces the back of the disc to tear quite easily. Other discs don't tear that easily because of the distribution of where the plumb line is. Plumb is spelled P-L-U-M line, plumb line. I think there may be a B, P-L-U-M-B, plumb line. All right, we are removing the herniation right there. You guys see the herniation? See how nicely the laser removes it? Now the blue is the herniation, but over time the herniation becomes scarred through chronic inflammation. And that scarring is what you're seeing right now, the white stuff. The gold color is calcium. There's a buildup of calcium, or spurs, bone spurs if they get big, and you get a calcification process occurring with chronic inflammation. The name of it is called dystrophic, D-Y-S-T-R-O-P-H-I-C, dystrophic calcification. That accounts for the orangish gold color. When the laser energy hits calcium deposits, which should not be there, by the way, it's abnormal for them to be there. When the laser energy hits that calcified annulus and scar tissue, it turns it a golden orange color, and that's what you're seeing. Okay? I'm working my way across the back of the disc to the opposite side where there is more herniation. We already saw that the herniation and annular tear is on both sides at this level. That's a piece of calcium right there. Any other questions?
No questions.
All right, at this point then, Anthony, since we already showed our audience how a herniated, bulging, ruptured disc causes pain in the neck, let's show the audience how we fix it with the laser, the Deuk laser disc repair.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
You can see how we use a tiny incision, no damage internally. We don't have to take your disc out like other doctors do. And we're going right past the normal part of your disc to leave it alone, get to the back where the problem is, and repair that herniation in the back. That's what we're doing, okay? This is all possible because of endoscopic technology. The problem is your surgeon doesn't know how to do this surgery. Okay, they've never been taught. This is the future of spine surgery. Think of it as like a stealth bomber. Not every country has stealth bomber technology. The United States does. Maybe China does. But that's it. And nobody else has this technology to be able to do it. So it has to be taught, it has to be shared, and that's what I've done for the last 15 years. I've been teaching surgeons around the world how to do this surgery. And I was noticing we actually have more people now in China that come to our website sometimes than we do in the United States. So we have a lot of interest from China and Singapore, Indonesia, that are coming and learning about our treatments here at Deuk Spine. Okay, because nobody wants to have invasive surgery done if it's not necessary. And right now I can tell you, in my opinion, as a board certified, very experienced neurosurgeon, about 90% of anterior cervical discectomy and fusion is completely unnecessary. 90%. That's what this patient was recommended for, and he didn't need it. And I see people all the time recommended for spinal fusion, and they don't need it, okay? Just keep that in mind. They need this surgery, far less invasive, no metal, no fusion. All right, any other questions?
No questions.
We got about 30 seconds left on this disc, and we're done. We're gonna move on to the next disc, number 6-7. All right, in that case, we've already showed the audience how a disc injury like a herniated disc causes neck pain, headaches, arm symptoms, and how we fix it endoscopically here at Deuk Spine. We repair it. We don't fuse it. We don't put metal in here. Okay, we just repair it. Looks good. I'm going to move on to the next disc. See how easy that was? Like I said, I've done now 2,700 2,768. This is 69. 2,769 of these surgeries. Think about that. That's a lot. And each patient, I do an average of 2.5 discs. What does that mean? It means that I've done 2,769 times 2.5 discs with endoscopic Deuk laser disc repair. And there's no bleeding. There's no downtime. These patients go home an hour after their surgery. And I think the most important thing is that it works. It eliminates their neck pain and their radicular symptoms, okay? And it's a permanent fix. In other words, patients don't have to keep coming back and getting it done over and over again, as long as they don't re-injure their disc. Okay? So re-injury does happen in one in 100 patients. Sometimes they just don't listen and they go out and do something foolish like play football too soon, or, you know, do some type of contact sport shot. They do something and they hurt themselves again. That's 1%. But 99% of our patients do not reherniate, and they don't need any additional treatment. Yep, lateral. All right, we're moving from number 5-6 down to number 6-7. Okay, just so you're aware of what we're doing. Wait, don't move. Shot. Yeah, 4-5 came out. Let me have it. 4-5 is going to want to come out. Shot. Because I'm pulling down on the skin and soft tissue. So it's going to move that needle out. Keep an eye on that. Shot, but I can't have you resist me, okay? So just let it go, but just keep an eye on it. All right, any questions? Shot?
Yes, we have 2 questions.
Shot?
The first one's from Lanu on YouTube.
Sure. Shot?
Can twisting and stretching the neck cause
AP?
trauma that leads to a herniated disc?
So can twisting and stretching your neck cause a herniated disc? The answer is absolutely not. No. The only way to get a herniated disc, you must have significant trauma like a fall or sports injury, a hit, a car accident, fall off your bicycle, you know, jiu-jitsu, you get clotheslined or cranked or something that really injures your disc. Shot? All right, I gotta just give me 1 second as I focus to get this in position. Shot? All right. I need a, I need a shot. I need an AP. I'm perfect on the lateral. I just got to get this centered. I need nothing. Thanks. All right, we're a little to his left. I got to move this back to the center. That felt good. Shot. I'm perfect, right on the center. Look at that. Show them the center. Center is right there. It's that circular piece of bone. That's where your spinous process is. Lateral. So give me just a second. I'm almost done. This is the hardest part of the surgery, by the way, in case you didn't know. Shot. All right, now I'm going through the annulus. Keep an eye on 4-5. Shot. Shot. Yeah. Shot. All right, we're almost there. All right, perfect. I'm at the back of c6-7. We've lost probably maybe 10 drops of blood, which is nothing. If you're having a 3-level fusion, you're going to lose a lot more blood than that. Okay? You're going to lose about, most surgeons are going to lose 150 milliliters of blood, ml. We're going to lose less than 1 ml, so 150 times less. Okay? So one of the advantages of our surgery here with the laser is less blood loss. And of course, fewer complications, since we've had 0 so far in 20 years. Shot. As I advance this tube so I can do his surgery, you can see the dilator is coming back a little. So I'm going to have to re-advance the dilator in just a second, but I'm going to give it a second. Okay, it's advancing itself. So that's good. I don't have to take it out and redo it. Shot. Any questions?
Yes, we have a question from Gary on YouTube.
Hi, Gary. Welcome.
Doctor, how do you control the penetration of the laser emissions from the tip of the laser?
Gary, that's a great question. So, Gary, the way we control the emission of the laser energy off the tip is through a what's called a change in the index of refraction. If you understand physics, you understand that as electromagnetic radiation, which is laser energy and light and everything else, electromagnetic radiation is transmitted in a waveform, and when it meets an interface between two matters that have different densities, what's called optical densities, it bounces. It changes direction. It can diffuse, right? So what's happening is when the laser energy gets to the end of the fiber and it comes out, it's not passing through air like you see in Star Wars when they're shooting laser guns at each other. It actually is hits the water, the liquid that we use to cool the laser energy in the tissues. It's irrigation. It hits that and it gets absorbed into the liquid shot, or it gets absorbed by the tissue, which is what we want. We want it absorbed by the tissue. As the energy is absorbed by the tissue, it breaks apart. No. It breaks apart, shot, the bonds in the tissue. And when it breaks apart the bonds in the tissue, it disrupts the tissue, and you get shot. You get the herniation breaking up into pieces. Okay? All right. Great question. We're at the back of 6-7. We've already done number c5-6. We're at the back of 6-7. We're going to get started on repairing number 6-7. So I hope that answers your question for you. I think it should. The question was, how do you keep the laser energy from, hold this, zapping out further than it's supposed to? And the answer is that when the laser energy comes out of the tip of the laser fiber, it actually, grab her, just keep just a gentle downward pressure. It actually gets either interacts with the liquid, or it interacts with the herniation or bone spur, whatever I'm targeting. And it gets absorbed by the tissue, and then it causes a disruption of that tissue, breaks it up into little pieces. And then we just suck those little pieces out. You guys ready? Here we go. Where's my pedal? I want you to look at that tissue down there real quick. Tell me what color you see. Anybody see the pink? You guys see the pink? That's inflammation. That shouldn't be pink. It should be white. So why is it pink? Because he's got a herniation. His body is trying to heal it by inflammation. And That is completely abnormal, but that's exactly where his pain is coming from. It's coming from the inflammation right here at the back of the disc. That was my discovery. That's why the Deuk laser disc repair works. It gets rid of neck pain, headaches from the neck, and what's called cervical brachial pain, which is pain radiating from the neck into the shoulders, into your shoulders. All those symptoms come from inflammation. Every one of them, even down your arm pain. Pain down your arm is due to inflammation from this back of this disc getting onto the nerve root, the dural covering of the nerve root, and it causes the dura to become inflamed. Now your dura, or nerve root covering, it's got pain fibers. It's got little nerves that tell you there's pain. Not every tissue in your body has pain fibers. Okay, most tissues do not. But we have certain tissues under your skin that are sensitive to pain. And one of them is the dura, or the covering of your nerve roots. This is all scar tissue here. The white stuff I'm zapping, it's turning golden color because there's calcium inside of it. There should not be calcium inside of this tissue. This tissue should be pure white, and it should be annulus fibrosus, which is organized collagen and elastin. That's what you're born with. But when you get an injury to your spine, like your neck, where you tear your disc and you get a herniation, that herniation is going to create inflammation. And the pain fibers transmit that pain up to your brain. So you know you're having pain. That's what we're fixing right now. We're doing what's called a debridement. And I'm the one who pioneered this technology here at Deuk Spine 20 years ago. I did the first debridement, and we published it in 2012, I think. No, maybe 2011 or 2010 was the first time at a meeting. And then I published it in a peer-reviewed journal back in 2012, 2013, and subsequently. So this treatment was pioneered by myself, and it's available here at Deuk Spine Institute for people who want it. If you don't want fusion done, this is your alternative, and it's far better than fusion because we're not opening you up. We're not creating complications like fusion does. There's no adjacent segment disease with the Deuk laser disc repair. There's no bleeding with the Deuk laser disc repair. There's no metal put in your body with the Deuk laser disc repair. There's no fusion. There's no metal. There's no plastic. There's no artificial disc. It's all natural. We're just helping your body heal. As a matter of fact, what I learned this technique from, it's called debridement. You learn it, every surgeon learns it in our training. See, there are people who need debridements. Okay, these are mostly diabetics, people with vascular disease involving their legs, where they pool blood in their legs, their tissues get swollen, and they have poor circulation. So then they get a little cut on their skin, and what happens is it never heals, and it just gets infected, and it gets full of granulation tissue. Sorry, not granulation, scar tissue, and it will never heal. It'll never close. And that's what we got here. This is what we're dealing with right now. We're dealing with a situation in the back of this disc where it cannot heal. What do you got there, Berndes? Any questions?
No questions.
Just about done, halfway done with the c6-c7. Our last disc will be the c4-c5. But we've already finished one disc, 5-6. We're doing 6-7. It's bad. Everything you're seeing here is scar tissue. It should not be here. And this thing was injured a long time ago. I can tell you probably 20 years, 30 years ago. This is not a new injury. I can tell how old these herniations are because I'm inside of it. I'm seeing the anatomical and morphological changes to the disc directly, which you can't see with an MRI. An MRI is not a real picture of the disc, by the way. It's just basically a computer-generated image that uses the energy released by atoms to create an image. There's a piece of herniation right there. So MRIs are not real pictures. I don't know if you people know that, but it's important to understand. It's called magnetic resonance imaging. You're using a magnet to resonate the electrons in different tissues of your body, and it excites the electrons and then it relaxes. So the magnetic field comes in and out, on and off. While it's on, it excites the electrons. They vibrate, and then the magnetic field shuts off, and the electrons stop vibrating, and when they do, they release the energy. Their vibrational energy, kinetic energy, is converted back into potential energy, but they release some of that energy, and it's picked up by detectors that are facing your body. And those detectors pick up the amount of energy being released by vibrating and by basically exciting and relaxing. It's called relaxation of the electrons. When they get relaxed, they release energy. And the type of energy they release depends on if they're water, or if they're disc, or if they're bone, or if they're blood vessels. Every different tissue in your body has different energy release. So the detectors can see those differences, and they give them a grayscale picture. Grayscale means color. So the more calcium, for example, the more dark you'll see. And the more water, the more light you'll see on a T2 image. So that's, an MRI is not a real picture. We're seeing a real picture of the disc. We're inside the disc, we're seeing a real picture of the disc with a camera and a fiber optic system that takes the image and sends it up to the camera. So this is the only time in the world you will see a real disc, is with endoscopic surgery on the disc. Okay? Every other tool that we use does not allow you to see the real disc inside the disc. Okay? Any questions? Man, this is bad. It's like
yes, we have one
a lot of
question
scar tissue.
from Daniel on Facebook.
Hi, Daniel.
Do you see these detectors on every endoscopic surgery?
Do we see what? That we're not doing detectors.
Yeah.
The MRI scan uses detectors. We're not doing an MRI right now. We're doing surgery. We're using an endoscope. An endoscope gives you a true image, like looking through a set of binoculars. Okay, you see a real image. It's not a digital image. It's a real image. Okay, and that's what we're seeing, is a real image inside the disc. We're not seeing something else digitally created. This is a real image. Jeez, look at all that herniation. Just about done here. More. Any other questions?
No questions.
Come on. All right, we've already shown the audience how 30 causes of neck pain, how a disc injury causes neck pain, and how we fix the disc injury with the Deuk laser disc repair. Correct?
Yes, that's correct.
Good. Every one of these is a piece of herniation. I'm floating it up. Floating up means floating out, getting rid of it, out of his body. Every time you see me come up and out, that's what I'm doing. All right, we're just about done. Any other questions?
No questions.
All right. How's our patient, Dr. Bernda? I'm going to clean up this foramen a little more, and then we'll be done. You guys see that? All that scar tissue was pushing on his nerve, crushing the nerve. The nerve is buried underneath the scar tissue. Now, the reason he has scar tissue, as I told you, is because he had a herniation. The herniation makes scar tissue. Your body attacks it, tries to get rid of it, but cannot get rid of it. So instead, you get scar tissue and bone spurs like that right there. I've already gotten rid of a few of the bone spurs, gotten rid of a lot of herniation and a lot of scar tissue. This is the last of it right here. Wow, it's so bad. So bad. A neurosurgeon, if you watch what I do, you'll see what I'm doing is quite remarkable. We're basically decompressing the nerve in the foramen. It's covered in scar tissue. And there's no other way in the world to do this. You can do microscopic. You're never going to see this view. This is only possible endoscopic. You can see the laser just removing all that scar tissue. It is impossible to do without the laser. No instrument in the world can do this but the laser. That's why this is the future of spine surgery. There's no doubt in my mind. Remember, I've done 1,000 fusions in my career. 1,000. And this is going to replace all of them. Unless you have a fracture. If you have a fracture, you'll still need a fusion. I think that's it. Let me just take one more peek here. We're done with 6-7. There's some few loose fragments, but let me just take one more look down here, get rid of a little more of this tissue. Is that, oh yeah, there's a nice piece to get rid of. Any other questions?
No questions.
We're done with 2 discs. We're going to start our third. Yep. I'm going to try to move us up to c4-c5. If I can, his neck is supple enough for the last move. Let's see if I can do it this time too. All right, we're going to bring our fluoroscope back in. Come on in, Jordan. Give us a nice lateral view. Watch that. Let's go. Our next surgery today is a patient with piriformis syndrome. All right, looks pretty good. Just about out. Shot. All right. Take that. All right. Here we go. Shot. All right. I'm going to move up. Let me have this. Shot. Uh-huh. Very good. I'm going to move up. Perfect. Shot. AP. Shot. All right. Perfect. Dead center. Go to the center. Perfect, perfect, perfect. I'm going to move up one more half of a disc. We're going to get rid of that needle in a second. Luis will pull it out. Yep, pull it out. All right, I'm going to move up. Shot. Just about there, folks. Shot. We're there. AP. We are now at number 4-5. Okay? Number 4-5. Perfect. Dead center. Mallet. I lost more blood with that needle, that's it, than the surgery. So if you don't want to bleed during your surgery, you don't want to have to take narcotic pain meds afterwards. This surgery is no narcotics, no opioids after surgery. Every other spine surgery, ACDF, anterior cervical discectomy infusion, PCDF, posterior cervical laminectomy infusion, laminoplasty, foraminotomy, all of those surgeries, every one that your doctor is recommending, requires you to take narcotic painkillers after surgery. Take it off. Okay? This is the only surgery in the world that does not. We stopped giving our patients narcotics for this surgery about 7 years ago. And we did a study that showed our patients never used the narcotics when we gave it to them. So we stopped giving it to them because they didn't need it. There's no pain after this surgery. All right, you can see the dilator coming back again. I'm going to just keep advancing. Pressure. Just about there. All right, we're there. Now we're at the back of c4-5, and we're going to do the surgery at c4-5, and we'll be done. Any questions?
Yes, we have a question from Z5 on YouTube.
Z5.
Yeah.
How can I help you, Z5?
Isn't there a possibility that this procedure could reduce the disc height?
Isn't it a possibility that this procedure could reduce the disc height? Great question, Z5. Why is disc height important? Are there people who have reduced disc height naturally? Absolutely. Everybody with a disc that collapses over time has reduced disc height. Do they all need surgery? 100% no. How many disc height lossers need surgery? 10%. And why do they need surgery? Because they lost disc height? No. Not because they lost disc height, because they have pain in their neck. Does disc height loss cause neck pain? 100% no. It never causes neck pain. Does disc height loss cause arm pain? No. It never causes arm pain. Does disc height loss cause myelopathy? No. It never causes myelopathy. Does disc height loss cause radiculitis? Nope. Never causes radiculitis. Does disc height loss cause the cows to moo? Nope. So what does disc height loss cause? Answer, disc height loss. Causes nothing. By the way, there's the tear. You guys have all been misinformed and brainwashed by doctors that are trying to sell you on some type of treatment you don't need. So that's why we let go. That's why we do this, because we know the truth. And we want you to know the truth. The truth will set you free. You don't need surgery for disc height loss. It's just a scam. You guys see the annular tear right there? I'm manipulating the tube to open it up. There it is. Luis, you see that annular tear? All right. I'm going to clean this tear. His body is going to heal it on its own. We've got 5 minutes left, maybe 8, 10 at most. So get your questions in, because we are almost done. Our next patient has back pain. We're going to do a bilateral piriformis release. Any questions, Anthony?
No questions.
Maybe our guest has questions. Scott, do you have any questions? How's irrigation? All right, Berndes.
No questions so far. Thank you, though.
I did not hear you.
This is Scott. No questions. Anthony's been answering questions along the way. Thank you.
All right, very good. That's great to hear. Well, we've talked about the 30 causes of neck pain. Do you have cervical facetogenic pain?
A video about that?
You do. It's a rhetorical question.
Oh, okay. Yeah, yes I do. Yeah.
Can you access it and play it?
Yes.
All right, I'm going to show you a video while we finish up this c4-5 disc with the laser. I'm going to show you a video about the second most common cause of neck pain, which is facet joint pain. All right, I'm going to keep working on removing this herniation and doing the annular debridement. This is all scar tissue here, mixed in with herniation. Meanwhile, Anthony is going to start a video for you to watch, teaching you how facet joint injuries cause neck pain. Flip it. Just showed you all the second most common cause of neck pain. It is actually little joints located behind your disc called facet, F-A-C-E-T, facet joints. These joints can become injured the same time you injure your disc. And many people have pain in their facet joints. The good news, we can now cure that pain at Deuk Spine. Other doctors will offer you a procedure called a radiofrequency ablation, or RFA. The problem with RFA, folks, is it always wears off. The treatment wears off. And your little nerves grow back and your pain comes back. So you have to keep getting RFAs the rest of your life, which, oh, that's a massive herniation. Massive. Look at the size of that thing. It won't even fit out of this tube. I have to go in and grab it with my grabber. And there it is. Now, it looks huge, doesn't it, when you're looking at it with the endoscope? But look at the actual size. It's like 5 millimeters. It's tiny. But that's how herniations are. They're not one piece, they're many pieces that are small. In the neck, they're around 5 millimeters, anywhere from 3 millimeters to 10 millimeters. And the surgery is all about using the laser to release them, aka get them out of there. Okay? That's what we're doing, getting them out of there. Once you get them out of there, something amazing happens. Neck pain goes away, headaches go away, arm symptoms go away, and it's permanent. They don't come back. Okay? As long as the surgery is done properly. Any other questions?
Yes, we have 2 questions. The first one's from SB Bappy on Facebook.
Hi there. Oh, another herniation. That's a biggie. Yes.
Do you suggest operation for disc degeneration issues like c5-c6?
Yeah, so SB Happy? Happy?
Bappy, B-A-P-P-Y.
SB Pappy is asking, Dr. Deuk, do you recommend surgery for degenerated discs? This is very important. I recommend surgery only when a disc is causing your symptoms. Only. Everybody alive has degenerated discs. If you're 40 years or older, everyone has herniated disc, degenerated disc. Okay? But very few people have symptoms. Dr. B, 3 minutes. Okay? Very few people have symptoms from their degenerated disc. If you have no symptoms, then I recommend no surgery. I hope that answers your question. No symptoms, no surgery. We don't operate on discs because they're degenerated. We don't operate on discs because they're thin. We don't operate on bone spurs because you got them. We operate because you're in pain. or you have weakness in your arm, numbness, tingling, okay? That's why we operate. Thanks for joining us. We're done. And I want to show you guys the whole incision. The incision for this entire surgery is right there, okay? I'm going to just do a little irrigating. And I'm going to take this out. I'm going to show you. We did everything through one tiny incision. Okay? Show them the tube. Here's the tube. See that? Tiny. 4 millimeters. I got 3 discs. If you had this done by your surgeon where you live, your neurosurgeon, orthopedic spine surgeon, they would be slicing your neck open, cutting through your muscle, cutting near your esophagus, your arteries and veins, pulling everything over, damaging nerves and tissues. You wouldn't be able to swallow for weeks. You're going to have hoarseness. But this patient, because he made the choice, the right choice, to get the newest, most advanced treatment, he's got a 4 millimeter cut in his neck. And he's going home in an hour. Literally going home. You guys see that? Look at that cut right there. This is the future of spine surgery. You guys are seeing it now. By the way, if you're in the military, which he was in law enforcement, you can have this surgery done and go back to your job. But if you have a fusion done or laminectomy or any other garbage that your surgeon recommends, guess what? You're going to have to be medically retired, most likely. So avoid invasive, unnecessary surgery. Do yourself and your family a favor. Come to Deuk Spine for the most advanced treatment in the world. Thanks for joining us.